In 1970, the hospital was built, and there was no hospital prior to that here in the county, but Scotland County Hospital was built in '70, and they were here, and in 1972, my mom, became pregnant with me, and I was delivered here at the hospital then in 1972, December of 1972. So we lived here in Scotland County for 4 years. So I was 4 when we moved from Scotland County, and my dad took a position at La Plata as the elementary principal, and so we moved to La Plata, and I went to kindergarten in La Plata. And then, so we were there 2 years, the year I was 4, and then kindergarten. Then he got an assistant superintendent's position back at Putnam County, which was where my mom and dad were originally from. They had gone to Unionville High School, and so he took that position at Putnam County, and we moved to Putnam County. And so I went through elementary school from first grade all the way through graduating high school there at Putnam County. I was really interested in science, in school. I liked, did good in all of my science classes and liked studying biology and chemistry and those kind of things. So, but I also had 3 family physicians in Putnam County. They worked closely together because, they would cover each other for call. And so I saw all 3 of them at different times and got along with them great as well. Had some, interesting, health experiences and life experiences where they really became role models of mine, and I looked up to them like heroes, I had a professor at Graceland who was my biochemistry professor, and he was also my advisor, my academic advisor, and he just sat me down a couple of different times and said, I think you should go to medical school. I just think you'll be a great doctor. You understand these things really well, and I think you should do medicine. And so I went back home and I talked to all 3 of my family physicians at different times and let them know what I was thinking about, and they said, you need to go to osteopathic medical school. They all 3 were DOs, and I don't even know if I'd seen a MD myself, just because in Northeast Missouri we all had DO physicians. And then when I completed medical school and graduated in 2000 from Kirksville, I accepted a residency position in family medicine residency through Southern Illinois University at Quincy Family Practice, who was associated with Blessing Hospital. So when I was in medical school, they had a program called the Primo Health Loan. It was a primary care initiative for Missouri to identify people who would commit to doing primary care, and they would pay college tuition for them. And I didn't apply for it until my sophomore year of medical school, but I did receive the Primo forgivable loan for my sophomore, junior, and senior year. So I was locked into primary care, and I had made the decision to do primary care mainly because of my childhood experiences with my family practice docs in Unionville. I looked up to them. I wanted to do that same kind of medicine. I wanted to live in a small town. I wanted to raise my kids in a small town. December of 2001, which was my second year of residency, I worked my first shift here in the hospital in the emergency department. And then throughout residency, I continued to do that 1 weekend a month here. So for the next 2 years, essentially, I continued to come back over. And my mom and dad had family friends here in Memphis, Missouri, and they were kind enough to open their home to me, and it was really close. It was a block away from the hospital, and so I would stay at their house, and I'd get a call to go to the ER, and I'd run over to the ER and help out. And that kind of sealed the deal for me. I fell in love with rural medicine and the community, and knew that that's what I wanted to do for my career.